Hey, this is Carrie from Wrap Your Head Around Silks. You're listening to the Expecting Aerialist podcast. So excited to announce that Wrap Your Head Around Silks now has a free mini course for anyone to take. It's geared towards beginner to intermediate silks students. I tackle things like the key to success to inverting in the air for beginners, fix your hip key forever, and rolling technique for shoulder mobility. Plus, I do a full silks act choreographed with dance transitions in mind. You can learn the full silks act in one of the tutorials. I'm so excited to have you guys check out this course. Go to my show notes, click there, and register to get a login. Today, I've invited our resident physical therapist, Dr. April Douglas, back on the podcast to talk about hypermobility. So much relevant information here. Let's get started. So I'm so excited to have Dr. April back on the pod. Hi, Dr. April.
Hello.
Yeah, she's our resident physical therapist and pelvic floor specialist. And I've asked her to come on to talk about hypermobility. I have a lot of students who are hypermobile. And on one hand, I have a little bit of a jealous greenness because they're super flexy.
Yes.
Yeah, and their lines are gorgeous. And they have this beauty about their joints because they're just like super flexible. But there's the dark side of that yin yang. Yeah. Because there's a lot of issues that come from it. And those same people are very, very consistently injured in small and big ways over the years. And I've seen them through this. And after seeing them through this, I'm like, maybe I'm not that jealous because that kind of sucks. So, and first I'd like to start by asking you, like, what is hypermobility? Because I feel like us dancers and aerialists like to use the term very loosely.
Yes.
Yes. So how would you define it?
So every joint in your body has an normal / average range of motion. So, it's generally if you can move your limb or joint outside of that normal range of motion or average range of motion. And all of us live on a spectrum. So there's some of us who are just stiffer than others, and then other people who are just really, really mobile. And then you can live in a space that actually is dysfunctional, or causes for maybe intervention, perhaps. And sometimes no intervention at all, but something to kind of watch out for. And that's when you get to usually like hypermobility syndromes and Ehlers-Danlos. That's when you kind of just need to check in on yourself. Not necessarily the end of the world at all. For some people, you don't need any intervention. And then others, you can be prone to other conditions such as like aneurysms and stuff. So,
what is hypermobility syndrome? I've never heard of that, actually.
Same thing. It's just like this generalized term where people just have more range of motion than the average.
And is this like kind of like the way, you know how relaxin works on our bodies during the perinatal phase? Is it just that your fascia is loosey-goosey, or is it more about the joints than the entire body?
I think I could be totally wrong on this. So I think it's the amount of elastin and collagen in your soft tissues. And so I think it's mostly a genetic thing. You can also train up to hypermobility. I mean, you see it a lot with contortion and just dancers, gymnasts, performers. So you can train into having excessive mobility. But generally in all of those fields, you're very strong as well. Clinically, in the physical therapy world, a lot of times what we tend to see are people that retire from the sport And you see it a lot with gymnasts because it tends to be a sport only for youth. Dancing a little bit too. Once they hit their 20s, they're a little bit deconditioned or they're not doing that aggressive training regimen. And they're not necessarily out of shape or anything like that. They just don't have the same regimen where they're at the gym every single day training. So then you start to see some funky patterns because that strength is lost, and especially strength at the end range of their mobility. So now they have to kind of come up with a game plan of what to do with that excessive mobility.
Okay, so just to clarify for myself, hypermobility would be defined as like the extra range of motion at your joints that's beyond a normal person.
Yes.
Okay, and then that would be caused by genetic factors,
Yes.
hyperextension training, blah, blah, blah.
Correct.
So you talk about end range. So I've been talking to a lot of people about this, nerding out on it. And
I love nerding out.
I love nerding out on end range strength building. Because it's so important. And I've actually been trying to figure out exercises for every single part of the body to train end range strength. But let's put a bookmark in that excitement really quick and let's build this to where that starts to make sense for people. Okay, so for example, my student Jacqueline, she is hypermobile. She is a hobbyist. She has a regular job. She's got great splits. Her back is kind of bendy. But she asks me all the time, like, how do I support my shoulders? Because basically the moment, not even the moment, it's random. Like she could do like motion Y 5 times. Mm-hmm. And then on the 6th time or on the first time, like she'll tweak something out.
Yeah.
And the big question is, how do we train to support her shoulders when that hypermobility is just a constant in her life? Like that is what her tissues always feel like.
Yeah. So great question. You see this a lot. Any sport that uses the shoulder, you actually see this in like pitchers and not just aerialists. It's really helpful to activate the lower and middle traps and the lats, basically stabilize the shoulder joint / your shoulder blade as you're doing a difficult motion. It's kind of like if you hang from the silks or hang from a bar and just hang and you don't activate any muscles at all. Versus if you're going to do a pull up, for example, first you're going to like activate lats and kind of pull your shoulders down towards the ground. Then you're going to utilize, traps and biceps and pecs and all that stuff and pull yourself up. But if you just completely hung and so you're just using your grip to stay there, then that's when you can kind of get into trouble, especially if it's a repetitive motion. So if you do that consistently, you're really just hanging by your tendons and ligaments, and you're not utilizing those muscles to stabilize and also to just like hold yourself together. It's also not really helping you with the motion or to keep you in place. So I wish I knew the specific moves, but especially with silks where like your arm, actually with the rope, you see it a lot where like it's behind your back and the hoop, if you just hung from that position and didn't activate any of those shoulder muscles, then it's just elongating and kind of pulling on those ligaments. So ligaments are bone to bone tissue and tendons are bone, tendon, muscle.
Okay.
Bone.
Say that again. Tendon is connected to bone and muscle.
Tendons are what connects muscle to bone. So it goes bone, tendon, muscle, tendon, bone.
Okay.
And then ligaments just connect bone to bone. So by activating muscles you are A, creating a movement because you're using the muscle, and B, usually approximating joints together. You're pulling things together. If you hang by just the ligaments, for example, that's where you just like grip onto the silks or hoop or whatever, or bar, and just hang there and don't do anything, then you're hanging mostly by your ligaments and not really activating. You're not approximating or pulling anything together per se.
Okay, so I'm trying to think of how to put that with my student's issue. Okay, so if she's doing a twisting motion that takes also strength.
Uh-huh.
If I would cue to her, pull your shoulders down and back, use your lats to bring your shoulder blades down. As she's doing the movement, that might be able to help her stabilize what she's doing.
That might be able to help. And then also changing the angle of her arm. So is it facing completely outward? Is her palm facing outward, or is her palm facing in towards her face? Also, just like the type of grip that you do. Sometimes those like small cues that may seem like they have nothing to do with that muscle just cues that person to hold themselves slightly differently. So it's something that kind of you have to play with on your own body. And I think especially for aerialists, because they're in such unique positions. So you really have to be trained like in all directions, all positions. Whereas, let's say a pitcher, for example, they have a baseball pitcher, they have one big motion that they do all the time, which is throw.
Yeah.
Now an aerialist, I would be like, okay, we're going in every single direction here.
Yeah.
Different types of grip at the same time. So what a lot of people do for training is they lay on the ground, they're face down, and we call them liftoffs in the rehab world. But you face your thumbs up, face your thumbs down, face your thumbs to the sides, and you lift your arm up off of the ground. So it trains that end range motion. And then you can also add weight. You can also like hold a weighted ball in your hand and just try and drop/pick it up before it hits the ground.
I'm laying on the floor, belly down, and my arms are over my head like Superman, or they're laying by my hips.
Over your head, straight. You can do in a Y position, you can do in a T position, and then you can do arms down by your sides. And so up overhead is usually the weaker range of motion. So a lot of times in physical therapy, we focus more on the overhead stuff, whereas down by your body, it's usually a little bit stronger. But yeah, so we usually like lift our arms off of the table or the floor or wherever you are. And you can train it with weight or without weight, with resistance, anything like that. But that's one of the ways you can do it.
You know, it's really tough for my hobbyists that, aerial class, especially in LA, it's not cheap, right? So they're spending a good amount of money for a 90-minute class. And we're going into these moves that are so complex. Like the one I'm thinking about that my student has a problem with, it's called flamenco grip. And basically we do a full internal rotation with the arm above our head, wrap our hand around a vertical silk. So like it's already really awkward, like super twisty. And then we twist more to get into it. And this is the thing that gets her all the time. And this is the base for some of our most common drops. It's hard because she's got, a 90-minute class. She wants to be in the air. And in my mind, we'd probably, in a perfect world, warm up this arm rotation on the floor for like a half an hour before putting her on the silk doing this really extreme torque, basically.
Yeah.
When I'm really good about warming up my body, like I'm doing stuff like, belly down on a mat and passing a ball behind my back and like getting that full range of motion through my shoulders. But it's not often, because life is busy, whatever. So I don't get it done all the time. But when I do, I feel so much better. So basically, I get where you're going with this. And I think that we just need to take the time before we're in the class situation.
Exactly. Yeah.
Yeah. Okay.
It's a lot of time and energy outside of the classroom, inside of the classroom. And sometimes it's just easy things like it's just a rope hanging from the ceiling or a TRX, and you're just kind of unweighting yourself on it and practicing that way. Whatever your goal is, you're always strengthening towards that goal. So if you want to be a really good runner, you probably shouldn't be swimming all the time. You should probably be running. So if you want to be a really good aerialist and the issue is that grip with your shoulder, then you probably should be working on that grip all the time. So I think what a lot of people fail to see is, sure, if you're a hobbyist of something, i.e. weekend warriors, a lot of times they forget like you're just more prone to injury because you're not training in between those times. And it could be due to lack of time, lack of resources, or, maybe you don't have a TRX or a rope that hangs from the ceiling, so you just have to get a little bit more creative.
Yeah. The person I'm talking about is a social worker, right? So she goes from her job and then she comes and she wants to get her emotional release and her workout for the day.
Oh, heck yeah.
Yeah. And then she's got a hypermobile body. And then, I would say 2 out of 10 classes, she heard something.
Oh no.
Or something. Yeah. It's kind of problematic.
Yeah.
So I also have my business partner, Kelly, completely separate. This is not about hypermobility, but speaking of sports specific and not doing those things. So if you are a weekend warrior, which I think this audience, it's probably more than 50% of my audience. It's probably closer to 85% of my audience.
Yeah.
The professional aerialists in the world, they might listen to my podcast, but, I don't know. Maybe
well,
not.
I
hope so. They probably already know me and feel a little bit obligated, but but there's a lot of like weekend warrior women out there. And my business partner, Kelly, with one of my businesses, the Greener Grass podcast, she just did this race called the Pelotonia in Columbus. And basically it's 100-mile bike ride for cancer. So she just did this bike ride and it's all hills at the end. She didn't train at all.
How is she doing?
I asked her, she's like, well, I'm all right considering,
Okay.
But that's the thing. That's the one thing I thought about when you said you got to train for your sport specific stuff to not get injured.
Yes. And obviously that's like an ideal world,
Yeah.
Weekend warriors get the term because we see it a lot. We always joke in our field that they keep us in business, but also most physical therapists, dare I say, a lot of us are weekend warriors. So, no judgment, that's for sure. I just went mountain biking the other day and I haven't gone for a decade in Big Bear, and I paid for it. It was super fun. I had a great time, but then I remembered like, oh, that's why I wear bike shorts.
Oh, yeah. You didn't bring the padding?
Oh, I did, but they were a decade old. So apparently my body has changed sizes since I've had a kid. And I was like, oh, it's spandex. It's fine. And no, it's not fine. So I had a little humbling moment in the bathroom and, I made it. It was totally fine during, but then afterwards I was like, ooh.
Oh.
For some people, they just don't have the time. But when you become injury prone, then that's when I think it's kind of like, okay, you need to check yourself before you wreck yourself and start coming up with a game plan for the hypermobility. I know I personally have really hypermobile shoulders.
Okay.
And I used to be able to party trick, like jump rope with my arms, like no problem, wrap them all the way around.
You could do a full dislocate. That's what the aerialists call it.
Yeah. So I could make them go all the way around, no problem. and thought it was like super funny. But there is a lesson that we always learn in physical therapy school is that you're not allowed to do party tricks. Party tricks are out. And in the circ world, you have lots of party tricks.
Well, they're training the party tricks. It's not necessarily throwing it at a party, but yes.
Right. So I think it's being more cognizant of like, is this a trained thing? Like obviously jump roping your arms is not a trained thing. That's just a funny thing I could do. And so after learning that, and especially with hypermobile shoulders, I started to treat my body a little bit differently. And this is just for me personally that worked, which I was like, no more pushing the boundaries of end range, especially when it's for something that's not strengthening. Like, why would I stretch hypermobility? I can strengthen hypermobility and still stay within my range. So that's how I treat my shoulders now. So a lot of people still stretch that end range when in fact low grade strengthening will still keep that mobility, but then also you're adding strength to it. You can control it better. Also, no more party tricks.
Also, no more party tricks. I don't have any party tricks that are like cool like that. I used to have this friend who could down like a beer, like a can of beer poured into a tumbler. So there's nothing getting in the way between his mouth and the beer. What? And it was a 2-second. He would take it, slam it back on the counter in like 2 seconds, basically. His mouth just opened up as big as a fish and like just swallowed it in one go.
That is incredible.
Isn't it? Okay, that's the type of party trick I never had. Like I never had anything because like it's actually impressive.
That's also a legit like party trick.
Yeah. Okay, so oh my God, shout out to my friend who could do that.
I'm not worthy.
I mean, I can't drink. I can't even do a regular shot. Like it just like my throat is like no. I'm a sipper. I like to sip.
I'm usually a half shot, 2 half shots.
Oh, okay. Yeah, I can't roll with that. Like I don't even know. Okay, it comes to mind, especially as a Pilates trainer. There's different ways that I've heard that people train ballerinas and people who have legs that go the opposite direction that they should. So basically, you know, if a ballerina is standing in first position where the heels are supposed to be together, knees together, turned out when they're standing like that, their heels are many inches apart and then their knees are together.
Oh, yes.
Okay, so this is one of the things that makes a prima ballerina a prima ballerina. Hypermobility through the legs is revered in ballerinas. I've been told by a couple different Pilates professionals that when they do footwork on the Pilates bar, they never have people go to their end range. They have them go to 180 and then just train that. I've worked with people who have hypermobility in the knees and it's really hard for them. And I could never really wrap my head around if I wanted them to go to end range or not.
Yeah.
I want your opinion on that. And number 2, how do we help these people not have pain throughout their later years?
Yeah. So I think it depends on your sport and what your goals are. So if you are a prima ballerina, you best be training all the way to that end range, especially if that's revered in whether it's wrong or right, but you're going to be doing it anyway.
Right.
Then you might as well be strong in it. The other thing, you know, like rhythmic gymnastics, you watch that mobility and you're like, holy cow, but you got to be really strong in that range of motion. So I would say it depends on your goals and sport. If it is the average Joe or Jane or maybe someone who is retired from the sport, but not really interested in being the prima ballerina, but just wants to be more of a hobbyist ballerina, then I would say train within maybe a little bit beyond the range, but not to their end range.
Okay.
Especially if I am training them not to like hang out there. I get concerned when, especially like on the reformer, for example, if someone goes all the way to their end range and then you can visibly see the like clunk into end range, especially with like the knees and the elbows.
Okay.
Because to me, that means they A, did not control it at all. And B, that they're probably just hanging on ligaments at this point. They're not really activating a lot of muscles during that movement, that end range clunk. So if I don't see a lot of clunk, but yet I see a lot of hypermobility, but they're still activating everything, then I'm like, okay, well, you're just a little hypermobile. And I just try to educate the patient on like, hey, do you see that hypermobility there? You're fine. It's great. I don't want you to hang out there. So you see that a lot with knees where people stand and lock out their knees and their knees are kind of backwards. So those people, I tell them like, if you are doing, if you are doing a move that requires you to have your knee like that and you're activating your quads and hamstrings and pointing those toes, cool. But if you're just standing there in line at Target and just letting them clunk backwards, like, I want you to like actually bend the knee a little bit and also know proprioceptively where you are in space. So then that you're like aware of what you're doing and what you're not doing. So I think it just totally depends. And also like, does it look clunky or does it look really well controlled? So a lot of people with circ, I'm like, holy cow, but it looks beautiful because it's so controlled.
Yeah, I've got a lot of students who come into the gym and they're just so flexible, but they're dumping into it.
Yes.
It is so obvious. And you're looking at the person and the beauty is not really there from my eye because it just feels really, goodness, what is the adjective? Like, I want to use the word draggy. I don't know why. Like, you know what I'm saying?
Yeah. When it looks clunky or uncoordinated, that's when I would tell them like, nope, you're not allowed in that range. You're not welcome there until you get stronger there. So I would tell them to only stay within the range where they can control it really well. And then it looks beautiful in that range. And then if they get stronger, great. But you see a lot. I mean, when I was taking aerialist classes on the silks, I was the one who was not an X dancer. Therefore, I did not have the range of motion that a lot of people had in there. So they looked beautiful when they were like stretching. But then when they went to go do the movement on the silks, granted, these were all beginners, including myself, I probably looked absolutely terrible. I might as well have been rolling around on the ground. But nonetheless, they had that range of motion, but they were just plopping right into it. And so you could tell from a mile away, at least with my eyeballs, that I was like, ooh, that's not good.
Oh. Well, especially when you get into those double foot locks and you're basically in a split that is completely unsupported from the ground. It's not like you're doing a split on the floor and you have the floor coming up to meet you. You're, crotch to the floor, tons of air below you. If you don't support that, you're going to dump into your joints.
Totally.
Can we go back to the ballerina or my friend Jacqueline standing in line at Target?
Absolutely.
So she also has that joint in her knees where it sways back a little bit. So for that person, if you ask them to stand at a 180 degree with, like a regular person's straight leg, do they feel like they're in like a tiny little squat? Like, do they feel like they're having to use their muscles to support themselves standing different than I would? Do you know that? I can't figure that out.
What I hear back from people is that it just doesn't feel relaxed.
Okay. Okay. That makes sense.
And for people that are like myself, who are hypermobile in some places, but not like their knees or anything like that, it's kind of similar to when you let like your gut dump forward or you let your hips come forward. It's especially with moms, you see it a lot. The hips like jut forward and you kind of hang on the front of your hips, or you're like propping the kid on your hip. It just feels actually just like comfortable / lazy.
Okay, got it.
So if I tell you to sit or stand in good posture, it just feels like it's work. And so with people that are hypermobile that like to kind of just dump their knees backwards, a lot of times when I tell them to not do that, it just feels like they got to work harder. They're like, well, now I have to activate my muscles and stuff. And sometimes it's just a habit. So your brain just has to be retrained a little bit. And then sometimes you're actually really are just kind of hanging out on your ligaments. So you really do need to activate your muscles a bit in order to stand properly. So most people just say that it feels like they have to do work if they want to stand properly. And then it feels like comfortable if they can just slam their knees backwards. So,
I see. But it would be the difference between me having like general good posture. It takes a little bit more energy, but not that much.
Exactly. It takes barely anything. And also like we're talking long game here. Like in the short game, standing in whatever position, you're fine. Like it's not going to end you. Bad posture, it's been proven many a times, is fine. It's the long game that a lot of people are really referencing here. So if you're like always slamming your knees backwards, but a lot of times these people have been doing that since they were kiddos. So, you know, that's 20 something years or 30 something years, maybe 40 something years of like throwing your knees back. So it just kind of depends on what the action is and how long they've been doing it. And also how long have they been untrained or deconditioned.
Okay. I love this. Can we go to my nerdy end range strength training now that we've brought our audience along, hopefully? So I feel like if I could come up with really good exercises for all this end range training for my aerialists, then everyone's going to be better off. For example, there's the one where we're doing a reverse climb. So basically, I'm doing an eccentric load of my entire body. So my hands start at my chest on the rope or the fabric, and I let myself down. Like I'm lowering myself down.
Yeah.
And then rewrapping and redoing it. So I call it reverse climb.
So usually with anything that's eccentric, so eccentric is the muscle is activated, but it is being lengthened. So a lot of times lowering tends to be eccentric. Eccentric motions generally are pretty celebrated in conditioning and also in physical therapy. It's been shown to be slightly more helpful as far as helping out with tendinopathies or tendinitis or whatever you want to call it. And it tends to help out a little bit more with power. So a lot of people praise having that a part of your training. And then also if your sport requires a lot of eccentric control, which for sure your sport does, then you definitely want to train it. So a lot of times you want to be able to train going up and going down. And then with the eccentric control, especially if you're lowering yourself, that's when you just need to make sure, especially with shoulders, that you're not plopping at the end there, that you're staying kind of activated. And again, it can be how you're gripping everything, the positioning of your hand. Also, it can just be like just purely activating lats and traps, maybe a little bit of pecs. There can be lots of different reasons why, but sometimes just playing with how your hand and arm is positioned can be really, really helpful.
Okay, so for my hypermobile client who gets hurt all the time to do this eccentric reverse pull-up, basically.
Mm-hmm.
In my mind, I'm trying to help her strengthen without doing the actual concentric work all the time because it's just easier on her body and it evens it out. So I guess the thing that I'm concerned about when I'm having her train is she says like, okay, the shoulder, it feels like this one thing is working, but this other thing isn't. When she's doing this eccentric work on the fabric, can we make sure that basically everything is involved? And how do we do that? Do I need to ask her to mentally activate all these muscles, or does the body want to do it naturally because it's loaded?
I don't know if I have the answer for that one. I think if it's something that is difficult for her to do, I would try and put it in the beginning of your training session, because sometimes when people are plopping or not controlling that end range, a lot of it is fatigue. And usually that end range strength is the first to go, because all of us tend to be the weakest. We're really good at mid-range and close to the body. And we also have a smaller lever arm. The further away from our body, if you're in like a T position, the like cross position, that's a really long lever arm. And so it's a really difficult move. Overhead, kind of a similar situation where it's just a long lever arm. So for more difficult tasks, if they're getting hurt or whatever, A, maybe modify them to make them a little bit easier. B, do them at the beginning of your training session. And C, she should probably be doing some conditioning at home and or doing a lot of conditioning work before or after her class with you. So then that way she can kind of fill in the gaps. And especially for hobbyists, if you just don't have a lot of time at home, sometimes it's like, all right, I need you to do 20 warm-ups before we even talk. So I need you to show up 10 minutes early or whatever and go through all your shoulder exercises. And then we're going to do the cool stuff.
I think that might be a good fix, because if we can get these things done in 10 to 15 minutes, then it's digestible and then you're ready. The hard part kind of comes in when you have a group class and not everybody needs the same things, but
Yeah, and if she's got drills to kind of do before
on her own,
then she's got drills for home, and you can say, hey, go get, these little silks that you can drill into your ceiling, and I need you to do these at home or something.
The other one that's very common is to be in a split at your not full end range, but a split for us that are comfortable in splits, and to push away from the floor and kind of lift up your butt off the ground in the split. Yeah. How do you feel about this exercise?
I think that's great. Kind of like the shoulder one, it's a lift off. So it's lifting off of the ground. I think is really good. Also, like sometimes giving cues for your toes or your heels, like push the heels into the ground, point the toes down into the ground, like dig in there, can be helpful. And then also some people need that upper body strength to reinforce and then slowly let go with your upper body. As far as eccentrics, you can start with like legs together and then slowly open up into the splits with upper body support. So then that way, if anything goes wrong, you just hold on tight. But all of that would be the eccentric loading too.
You know what? I've just dreamed up a new exercise for my people.
Here we go. Now we're
wrapping the arms, sliding into a split, and doing a pull up and sliding up out of it.
Now we're cooking with gas.
Now we're cooking with some kerosene. Oh my God, I'm going to do it. Okay. And I got to get some like furniture sliders for their feet.
Oh, that would be even better.
Oh, not furniture sliders. They have them for the gym too. Oh. Whatever those things are.
Yeah.
Yeah. Or shower curtains. Shower caps. Put them on the feet. Those little booties that they, they use at the hospital and stuff. Yeah. Oh my God, I'm dreaming it up now. I love when I think of new stuff. It's great. Dr. April, this was very sports specific.
Yeah.
And I love it. Thank you so much for, speaking on this topic, even though it's a little bit wishy-washy.
Yeah, hypermobility is wishy-washy. But I will say one big thing to know is it's not a bad word. Hypermobility is not a bad word. And obviously, in your sport, it's celebrated, in fact. When it is not great is first and foremost, a lot of people screen for the Baton scale.
Mm.
So Beighton.
Okay.
The Baton scale. And that's the one where it screens like how hypermobile are you? So if you get a 5, I think it's out of 9. If you get a 5 out of 9, then it's a positive Baton scale. And that's when you're probably looking towards like Ehlers-Danlos and stuff like that.
And can you define Ehlers-Danlos?
Ehlers-Danlos is under the umbrella of hypermobility syndromes. It's genetic in nature. And I believe there's multiple types of Ehlers-Danlos. Not the expert on Ehlers-Danlos, but they tend to have, that's when they can have a lot of other complications. Their fascia is a lot more stretched out. So that's the people who a lot of times can have risk of aneurysms.
Okay.
Yeah. So there's just a few more risks with that. Also, if you talk about like childbirth and stuff, sometimes people with Ehlers-Danlos electively choose to have a C-section for fear of too much hypermobility at the pelvis and at the fascia of the pelvic floor. And a lot of times there's multiple dislocations. So their skin tends to be different. Lots of dislocations or subluxations. So subluxations are dislocations where they go back into place. So they pop out and then go back in. That's a subluxation. They might have more hernias, prolapse, all that stuff.
Yeah. And it's just the idea of that fascia just not being super tight. And so all these things follow. We didn't talk about dislocations and subluxations of the shoulder, but that happens a lot too. Like I have students who have easily dislocated their shoulders while in a trick.
Mm-hmm. Yep.
So scary, but it's just about supporting, right? Building that support structure around the shoulder so that it doesn't happen as much.
Yeah. Also, if you've dislocated once, you're more likely to dislocate again.
Right.
So
okay.
dare I say, there's some people where it's just not your sport, like it may not be for you. Similar to when you have a certain amount of concussions, like maybe football isn't your jam, or rugby or something. But so if you dislocate once, you're more likely to dislocate again. So if you do dislocate or sublux, it should be a huge fat red flag of like, all right, you really need to work on this joint before you start pulling on it again. And also there's certain directions that depending on how you dislocate it, usually you're dislocating towards the front, towards the back, or downward. And then if you have multi-directional, so for example, if you can jump rope with your shoulders, you likely have multi-directional hypermobility, which means you could dislocate any direction you like. And so sometimes that's from the shape of your labrum in your shoulder joint.
Okay.
Sometimes it's laxity of the joints. Sometimes it's poor activation of muscles. Sometimes it's all of the above. But history of dislocation is kind of your number one risk factor. Like if I were a coach, that would probably be on my screening tool for new students of like, have you ever dislocated? Because then I would probably not be putting them in certain positions to start out with.
Okay. So like the simple answer for the people out there with all the joints, because we didn't talk about the back a lot. We didn't talk about the elbows, is that we need to meet this hypermobility. We need to meet all of our flexibility with strength.
Yes.
Would that be a good bottom line?
Yeah. And also just be like cognizant of it. Everyone's got their thing and you can utilize it to your advantage, and you can also just ignore it and see what happens. And a lot of times if you're someone like myself that just has like random hypermobility in certain areas versus all over hypermobility, then likely you're stiff surrounding that joint.
Okay.
So like hypermobile shoulders tend to have this is all like clinical stuff. So nothing rooted in research here, but you tend to have pretty stiff rib cage and thoracic spine. So really stiff hips tend to have pretty mobile low backs. So your body tries to find the motion somewhere.
Right. And compensation too. That's what it is, right?
Totally.
Your body's compensating for the hypermobility. I have to say, we have successfully gotten me to a place of appreciation for my non-hypermobility in this hour.
Yeah.
Like, I'm like,
Nothing wrong with that.
It's okay.
For the people that are stiff out there, a lot of times they lament being so stiff. But in what often I tell them is like, hey, you can train, you can stretch that stiffness generally.
Yeah.
It's hard to stiffen up something that's hypermobile. So everyone's journey is different, but sometimes the hypermobile is harder to treat than something that's stiff. Stiff you can loosen. Something that's loose is hard to stiffen up.
Yeah. That is a good reminder, as the next thing I'm going to do tonight is massage out my forearms. Because I decided to do this one skill on silks on Monday, 8 times, like a whole sequence. And it was really grip strength based, like a lot of grip, to get my Instagram video, right?
Oh, yeah.
And guess what? I didn't get the Instagram video because I messed up once in every one of those 8 videos. So I haven't posted it. And my forearms are like Popeye, and my body, because I have the opposite problem, my fascia is very tight and my body builds very tight. I do not retain my length easily. I know this because I'm a body worker and I touch a lot of people's bodies, and wow, other people don't feel like me.
Yeah.
But it's also the reason I look like I'm like really young, I think.
Well, I mean, as someone watching your videos, to me, I wouldn't be able to tell at all. Like you've trained yourself into that mobility, and it looks awesome.
Well, I guess I'm comparing myself to like the contortionists that are right beside me. You know what I'm saying? I'm not really comparing myself to everyone.
Well, that's not super fair. Yeah.
Yeah. But then also, like, if I were to show any person all the 8 videos, they'd be like, any of these are fine. They're totally fine.
They're always our worst critic.
But I couldn't do it. I was like, I'm just going to be mad at this video. I'm not going to put it up. And I'm probably going to try to refilm it tomorrow when I'm in the gym. So these forearms have got to start complying with my plan. But these are first world problems, and it's going to be okay.
It'll all work out. It will all work out.
It'll be all right. Dr. April, you are a wealth of knowledge. And the next time I have you, I'm going to, again, say, hey, can you talk about this one topic? And then I don't have to do anything. And then you have to go research that topic for like a week. And then all I do is get on the phone with you and ask you what you've learned or what you've reminded yourself of. It's not really fair, but.
It's totally fine with me.
You're the expert. I love it. I'll do it to Dr. Emily Sherp too. I'll be like, can you talk about this one thing? She's like, oh my God, hold on, wait.
We got you.
All right. Dr. April, you're amazing. I thank you and look forward to you being back on the pod again.
Thank you so much for having me. It was fun.
Thanks so much to Dr. April for being here today. And as I mentioned at the beginning of the podcast, check out my show notes for the link to register for a login to the student portal for the free mini course available to anybody. So go ahead and check that out. That's a gift from me to you. I really hope to teach you online. Thank you so much to Asa Watkins for post-production. And if you would honor me with a 5-star rating and review anywhere you get your podcasts, it really helps others find this community easier. And thanks so much for listening to the Expecting Aerialist podcast.